Critical access hospitals are the connection to care for families living and working in rural communities across the country. We hope that you gain insight to the tremendous contributions critical access hospitals make in order to keep millions of rural families healthy. In the end, we hope the information instills a greater level of appreciation for critical access hospitals and the role they play in our nation's healthcare system.
Critical access hospitals are essential for Illinois to function properly. There are over 51 critical access hospitals, which represents about 25% of the 200 hospitals that we have in Illinois State. The hospitals are located in rural communities. They are across the state from Galena all the way to the metropolis. The critical access hospitals are the rural safety net, providing primary care. They provide surgery and emergency care, and for approximately 60% of the counties who require care, over 1 million rural residents total. So this is really a very important thing to be in place because these patients would otherwise not have traditional access.
The Critical Access Hospital Program came out with the Balanced Budget Act of 1997, and the reason it was started is because the current Medicare reimbursement system of prospective pay and DRGs was really hurting rural hospitals. Typically, though, that type of payment system is going to pay based on volume. The more volume, typically, the more financially stable a hospital can be. A small rural hospital doesn't have that kind of volume, and a lot of hospitals were closing in rural areas. So with the Balanced Budget Act of 1997, they went back to the original system that the Medicare program paid under, which was a cost reimbursement system. They realized that these hospitals may not have the volume, but they had the need in the community for the hospital, and that's why they shifted that payment system to cost reimbursement.
Many of our nation's rural and critical access hospitals were built 40 to 60 years ago. Rural hospitals are the cornerstone of their communities. Many facilities have reached their useful life and capacity for growth. They can no longer meet the ever-changing expectations of patients or become compliant with today's patient privacy requirements. Another challenge for the aging critical access hospital is their ability to recruit new physicians. A modern emergency department, surgical suites, and the latest technology are very important elements to attract physicians. As a result of the Critical Access Hospital Program, the majority of these hospitals have been able to undergo a major modernization or full replacement hospital project. But the road to a new facility is a long one. It takes vision, commitment, patience, and capital.
Many of the critical access hospitals are anywhere from 60 to 100 years old today. And what that means is the systems and the infrastructure and the design does not fit the technology in contemporary medicine. One of the things that most are going to in a renovation or building are going to all private rooms, and to make sure that they are handicapped accessible with their baths so that you can actually get into a shower. There's a seat within the shower so that the bathrooms are fully accessible. And back when our facilities were built, they weren't built with our current ADA guidelines in mind.
We went from an old antiquated facility to a brand new hospital. actually a year ago in May. So kind of overnight, we had a modern facility. But one thing we did leading up to the new hospital, we did a lot of research, and a lot of our directors went out on site visits and looked at, what's the best way to provide surgery in a hospital our size, what's the best layout for the inpatient unit, and we really tried to put in best practices. A lot of people saying, at first I didn't think you needed a new hospital. We did a really good job of patching up the old facility and making it look nice, and so a lot of people really questioned, do we really need this? Should we spend the money on this? But those same people are the ones that are coming back and say, oh, I had no idea. We didn't know what we were missing, until we came to the new facility. So we still get compliments every day.
It is incredibly rewarding and just also very humbling when you stop and think about the fact that what we are doing today in terms of building a replacement hospital is going to impact the community for 30, 40, maybe another 50 years. So we literally do make history in our community when we do a replacement facility.
There's a saying, without physicians, we have no hospitals. While physician recruitment in rural areas continues to be a challenge, critical access hospitals have developed many innovative solutions to bridge the gap and have become a highly attractive practice opportunity for allied health providers and physicians.
Well, I think some of the recruitment challenges for physicians today are, I guess I'd put them maybe in two categories. One is what's going on in medical education in this country, and how does that impact the rural communities, and what's going on within each of the communities. So, and they interplay, those two broad areas interplay with one another. So, for instance, on the medical school side of things, in order to most appropriately provide physicians for rural communities and obviously critical access hospitals, primarily we're looking at primary care physicians and even more specifically family practice physicians. They're the ones that are trained to cover the breadth of problems that and can be supported easily in rural communities. We've been in one of those downward sort of troughs that we see in medical education. And if you look at over time, there's an ebb and flow of specialty choices among medical students. And we've been in a trough in terms of students picking primary care. So the big challenge for rural communities is the fact that the kind of physicians coming out of medical schools today aren't in the numbers, in the kinds that they can most readily use.
There's this perception that at a critical access hospital you can't use your spectrum of skills that you've developed. I think the other thing that comes into play is the size of the community, depending upon where the physician is in the stage of their career. There's family issues that come into play. The part that I think a lot of physicians underestimate is that at a critical access hospital, your ability to directly affect patient care is much greater.
I think we see a much wider variety of cases and medical issues than you would in the city. A lot of people in the city would get spoiled and they go see a specialist. They don't stop by and see a family practitioner, but here they'll stop by here first because I think they trust us a little bit more and know us a little bit more before they move on to a specialist. So it's definitely more challenging. We see, everything from newborns to people in the nursing homes. So we see everything and anything in between.
Our department was looking for opportunities to expand our influence, so to speak, and also having an abundance of physicians who graduate every year. We graduated about 16 emergency physicians every year, and it turns out that the Midwest Medical Center was looking for staffing for their emergency department, and particularly they were looking for staffing that they could easily recognized as being high quality. So their preference was for a university-based group of emergency physicians. And it was, I guess, just a matter of time or coincidence that we got together and began talking about how to do that.
Some of the new models we're looking at are that people are looking at are what's called a hospitalist. I will say, for probably 30 years, we've used that model. Many years ago, our physicians, the family practice physicians, volunteered and covered our ER. When they covered it, each person, each staff member who wasn't on call that night was able to go out. They were not on call. They did not have to come to the hospital and see their patients. They did not have to worry about their patients after hours because they knew they were going to be taken care of. We've been doing that now. We have our own employed physicians that watch our emergency room. And when they watch the emergency room, they're also our hospitalists who take care of any patients on the floor. In Carrollton, we have 4 rural health clinics. No one has to take call. And it's an added bonus. You can work your days. You don't have to take call because you know your patients are covered. And when you come back the next morning, they're your patients back again.
With the critical access program, that helped stabilize the hospitals and makes them a more attractive place to practice for physicians.
A strong, viable, and modern healthcare facility plays a key role in rural communities. The Critical Access Hospital is typically the community's largest employer, and healthcare facilities are important purchasers of local goods and services, contributing to the growth of local economies.
Critical Access Hospitals a lot of times are the largest employer in the county or the town that they're in. So understanding how we work and how important we are both to their healthcare and to the economy is very important.
We had a study done a few years ago, and our facility hires approximately about 190 people. And the secondary impact was a creation of approximately about 70, 80 jobs in the community that, and you stop and think, those are jobs that wouldn't be in this community if the hospital wasn't there. So these hospitals play more than just the fact that they're there for health care. They're there and they create jobs in the community, which that secondary impact creates other business such as the tire shop or the restaurant in town that opens or the gasoline stations that's there. Those operations, those businesses would not be there if it wasn't for the secondary impact caused by the creation of those jobs from the original hospital that's there.
I've often thought when you combine quality health care with jobs and the opportunity with economic development, that's a win-win situation. That helps for a better community, that helps for a better future, and that makes my city and where we actually live, work and play, that makes us more diversified for other economic development opportunities.
You know, our hospital district has a levy, of course, but it's a very minute component. It's less than 5% of our annual gross budget, so it's a very, very small percentage. A lot of people in these small communities think that the hospital tax is a heavier amount and that a lot more of their money goes to the hospitals, but we've constantly tried to make assurances that we keep that tax as low as possible. With our hospital project, we knew that if we were going to build our hospital, we had to go out to the community and tell them, and we had meetings throughout the whole county describing how our project would work and that we would not be raising their taxes. And that's the benefit of a critical access hospital, and you can do so much because of the cost-based reimbursement. You know you're going to get that dollars back through the Medicare program because of critical access, so you do not have to pass those taxes along to the average taxpayer.
Critical access hospitals have realized the power of partnerships. Through unique academic medicine and technology alliances, grants, and government programs, critical access hospitals have unlimited potential to expand services, improve quality, and educate their workforce.
It's interesting, when you started with the critical access program, you had one critical access hospital, and you had more until perhaps in Illinois we have 51. In other states they might have over 80. Some states have very few. But what happens when you bring these small hospitals together, instead of being one 25-bed hospital, all of a sudden, like in Illinois, 51, you're 1,250 some odd beds, when you add it all up. So when you work with organizations, large state organizations, agencies, when you're trying to make change or you're trying to purchase equipment or things like that, it does become advantage. You don't lose your smallness that's unique to your community, your reach out and touch type value, but at the same time you're able to gather some purchasing power and be able to make an impact and get your voice heard. And that's very important as we stay viable and keep our rural communities strong.
We really feel committed to serving the region, and our mission is really to assist the people in Central and Southern Illinois meet their healthcare needs. We know we can't do that alone, and we know we can't do that by bringing everyone to Springfield. So technology is one way to bring the resources to the community, and we do that through SIU's programs, but also by partnering with community organizations.
In Illinois alone, there was over $1.5 million that was giving out to hospitals through what they call a small hospital improvement program through the federal office, as well as through the Medicare Rural Hospital Flexibility Program. There are also some other funds through the state, downstate grants through the Department of Public Health, Center for Rural Health. They're very supportive of the critical access program. So as an organization, these small hospitals have learned how to find funding sources and make them available and do great things with it.
While we're a school of medicine and we focus on education for physicians, the healthcare team that supports the doc also is oftentimes isolated. And I think that's what Pat Scow, director of the Critical Access Hospital Network, does, is bring in a lot of the allied health education, management training, HR development, quality assurance teams that come together. If you're a quality assurance manager and you're the only one in your hospital and in your town, it's a very isolated sort of job. So how do you learn new techniques? How do you sort of spread what you've learned and your core expertise to others? And so they come together through video conferencing. My motto is we can't solve these big healthcare problems alone. People have to work together, and this technology just allows people to come together to solve problems.
Rural healthcare is complex, and leaders in critical access hospitals understand how to meet the unique challenges rural communities face. They are deeply involved with communities and their efforts that are promoting health, preventing disease and injury, and working toward the elimination of health disparities in rural America.
We are the primary resource for any health education. If a patient has a new diagnosis, they would either call their doctor at the hospital or come to the hospital for information, which we would certainly provide. We do all of the ongoing community education. We do men's programs and women's programs, programs for teens, programs on menopause, just about anything, because we really are the only one in the community that has that expertise.
The uniqueness of a critical access hospital is their relationship with their community. They know their medical staff, they know their employees, throughout everybody pretty well knows each other, they know their neighbors, and they're really that primary source and that emergency source for that community. They're really where it's at. Where you get in a larger community, you lose some of that identity. And, people value working with somebody that they know and trust.
In a small rural community, they truly value their hospital. They see us as their link if something happens, if there's an accident, if their son's, in a terrible car accident, or, they have a heart attack. We're their link to get into a tertiary care center. And I don't think you have to sell our community on the value of our hospital. They've been coming to our hospital for generations and having, their mom died there, their babies were born there. They come there for everything from stitches to, a major trauma. So I think they view us as a critical link into better health care or to more tertiary health care. I think sometimes it's the bigger cities that we have to sell on the value of small rural hospitals because they think we're Band-Aid stations. And we're not. I mean, we have the same technology, we have the same Joint Commission survey that large downtown Chicago hospitals have. And I think that's an important point for people. But I think if you ask someone who lives and sees what we do day in and day out and hear the ambulances and the helicopters, they know who we are and they're very supportive.
It is inconceivable to think of a rural community without a hospital nearby, responding to medical emergencies, providing comprehensive primary care to the young and aging, creating jobs, and helping to grow local economies. Critical access hospitals, not only necessary providers, they are the essential connection to health care for families living in our rural communities.